Now it's your turn to get free advice from the dentist. Dr. Mark Hyman is here to take your questions about cosmetic dentistry, family dentistry, you name it, he knows it. The number 1-800-807-8255 to call in if you have a question. Good morning.
Good morning, Cindy.
Good to see you.
Nice to be back.
We actually have a caller from Lexington. Tamara's on the line. Good morning.
Good morning.
Hey, Tamara.
I have a question. I have had deep fillings and deep cavities, and they filled it down to the almost to the root. However, that same teeth is starting to crack off. Is there anything else they can do other than pulling it?
Tamara, I'm sorry you had those big cavities. Sounds like your dentist tried the conservative approach to get rid of the decay to help you keep the teeth the rest of your life. Now that part of the enamel is starting to break off, what they can do is secure the tooth with a crown or a partial crown. So I would go see your dentist and see what's appropriate. Generally, we tell people when the cavity is beyond the middle third of the tooth, it needs some sort of restoration like a crown or a partial crown. So I applaud them for being conservative. It just may be time to move to the next level. You also might want to discuss with them about getting a mouth guard, a bite guard to protect those teeth. If you may be grinding your teeth at night unwittingly, then that's a way to protect those restorations as well.
Let's go to Don in King. Good morning, Don.
Good morning. I was wondering, you recommend having anchors put in for your bottom dentures, and if you do, what does that involve, or should I just use like Polygrip or something?
Right, Don, I'm sorry if you lost all your bottom teeth there. Generally, top teeth, the top dentures can fit pretty well because it's sort of like a suction cup. The lower jaw is kind of like a U shape, like a horseshoe. So if you have the opportunity to get a couple dental implants, 2 of them or 4 of them, then you can turn something that's movable and loose into something that's fixed and very predictable. So basically, it would take about 3 months for a dental implant to heal. It's like growing a synthetic root, a synthetic tooth. Seems like it may be a large investment for starters, for the quality of people's lives, for them to be able to chew and sing and kiss. People just report that they're fantastic. So I would go see your dentist and see, is implant dentistry appropriate for you, and how many, and good luck to you.
Let's go to Debbie in Haw River. Good morning, Debbie.
Good morning.
Hi, Debbie.
Cindy, I want your earrings.
Oh, thank you.
Dr. Hyman, I have 2 teeth missing on the bottom on one side and 2 teeth missing on the top on the other, and I'd like to get not partials, but bridges. Do I need to have crowns put on the teeth to anchor them, or can they anchor them on the teeth if they're good?
Right, where you're missing those teeth, Debbie, if you've got a tooth behind the missing teeth, a bridge is certainly one option. There's another choice to have a partial denture where the teeth would come in and out. What we just were talking about, to me, the best thing in dentistry today is to consider a dental implant, which again is like a synthetic root that's placed into the bone. It's like growing a brand new tooth, and it has a chance to last the rest of your life. A well-done bridge, we hope, could last maybe 10 years. So you sound young, so potentially you could have that bridge redone 2, 3, 4, 5 times, where a dental implant has a shot at lasting the rest of your life. So again, I would talk to your dentist and see, is that appropriate? I hope it is.
Let's go to Elaine in Germantown. Good morning, Elaine.
Good morning.
Hi, Elaine.
What's your question?
Okay, about 6 years ago, I had all of my teeth surgically removed in Chapel Hill. And anyway, they had to do bone reconstruction of the upper and lower jaws. However, after doing so, they did that so that I could hold dentures.
Right.
But my dentures do not want to hold. I use an extremely lot of, denture cream, Fixodent and so forth.
Right.
I wanted to know, is it possible that the teeth, the bones could have shifted and possibly caused it to, where my dentures won't fit? Or, did they just not cut away enough bone for my dentures to fit?
Elaine, it sounds like they did their best effort to do a bone graft to build up your ridges. Over time, that bone will dissolve away slowly unless there's something in there to stimulate it, which is, again, why we talk about dental implants. Having a synthetic root in that area where the bone graft was. The bone grafting was a great attempt. We now know, 2013, that if we can put a couple implants in that area, the bone will stay in there just like natural bone will around a natural tooth.
Interesting. You brought with you something that I think is really neat, like for brides, or if you're wanting to get your teeth whitened for like job interviews and such.
Right, it's June, so for brides, for kids interviewing, for people just looking to have Christmas in June. There's great opportunities. This is a little mini version of our Zoom lamp where the patient would lay underneath this. We place a protective gel on their teeth, the whitening gel on their teeth, and then the Zoom lamp will zoom them. In about an hour, you'll get 6 to 8 shade changes.
Wow.
Which is fantastic. Traditionally, some people want to wear the whitening trays, which will take about 2 weeks to get that result. So that's an example of this, which is the Zoom Day White or the Night White. And if someone's got an interview in an hour and they just need a quick touch-up, a quick hit, this is the Zoom Whitening Pen, where you can just put the peroxide on the teeth themselves, get you just a couple shades whiter, and go in there and kill that interview.
Neat.
So it's a lot of good stuff going on in dentistry.
A lot of neat stuff. Thanks so much.
Joy to be here.
Good to
Thank
see
you.
you.